and esteemed scientist delegates. I am going to present my paper on the topic Technological Intervention for Generating Biometric Data for Indian Population. Biometric data to generate authentic, verifiable and reproducible biometric card for the girls student of Mewar region. And it includes scanning of fingerprinting, face recognition, DNA, palm printing, hand geometry, iris recognition, retina, order, scent and hormonal cycles as the girls transit from post-pubertal to fertile stage. Next. So, for this we need screening of physical features for inclusion in biometric card for each girl individually. And for this we have some parameters. First we will take height, average height which entails about health and wellness and which describes quality of life and standard of life. But dwarfism and gigantism are the due to hormonal disorders. Weight by divine formula 40 ideal body weight is equal to 45.5 kg plus 2.3 kg where height is taken in meters and minus 60. Body mass index where height is taken in meters and weight is taken in kilograms. Here biometric card is essential for each girl for characteristic identification for each girl student and blood group, determination of blood group for just A, B, AB, O, Rh positive and Rh negative group. Development of mammary glands in pre-pubertal and post-pubertal girls in order to prepare a mammogram and pelvic measurement. Gradual widening of pelvic region is indicative of reproductive age, fertility and related matters. Next. Here the picture shows the position of endocrine gland, hypothalamus, pituitary and various endocrine glands in a human body. This slide shows the endocrine gland which secretes hormones from hypothalamus axis to pituitary and its effect on various targeted tissues which in turn secrete their own hormones to facilitate homeostasis or homokinesis. This picture shows the developmental stages of a girl child from birth to pre-adolescent period, pubertal period, post-pubertal period and fertile stage and to menopause stage. And this slide shows the hormonal cycles of FSH, LH, estrogen and progesterone and their effects on ovarian and uterine cycles. The main purpose of our technology, where technologies are used for endocrine profile, for determination of endocrine profile and status of a fertile girl. Technologies such as biochemical estimation will be used for qualitative and quantitative estimation of FSH, LH, LHRH, estrogen, progesterone and beta estradiol in qualitative and quantitatively in breath, sweat, saliva, urine and blood. First, breath analysis. It's a non-invasive technology for determination of endocrinal disorders. Exhale breath contains near about 200 volatile organic compounds and which are the biomarkers of endocrine disorders. Heliometer, breath analyzer and nanodetectors are the analytical instruments which can detect a small quantity of endocrine disorder, this organic compound and which can form a biochemical fingerprint which is used for the detection and diagnosis of pulmonary malfunction and breast cancer, etc. Next, sweat analysis. It's done for diagnosis of hormonal disorders and it's done by sweat analyzer. Hormonal disorders which are responsible for cystic fibrosis and inherited disorders can be diagnosed by this sweat analysis. Cystic fibrosis occurs due to defects in the body protein as defective sweat glands which contains defective epithelial cells and which are present in skin, lungs, liver, kidney, pancreas, and in other reproductive and digestive system where they secrete abnormally. Next, saliva. Saliva is used for identification of endocrine disorders, immunology, inflammatory infections, Cushing's disease, hypogonadism, and ovulation, allergies, HIV, cancer, parasites, etc. Saliva is a genetic material and is a biomarker of nutrition status. As we say, or as it's a valuable biofluid, has a specific uses in clinical tests and experimental psychological settings. It provides insight into human behavior, anxiety, emotions and their development, post-traumatic stress disorder and other behavioral disorders. Saliva measures alpha amylase and cortisol, which are the measurements for stress level. In 2015, it is reported that salivary LH is a biomarker of ovulation in females. Next, urine test is done for diagnosis of tract infections, kidney disorders, pancreas and liver disorders, and other metabolic conditions. Metabolites of estrogen, beta estradiol, and progesterone pregnenolone can be identified biochemically, quantitatively, and which tells about the fertility cycles or failures, etc. Next. Next, we will do blood test, where we know that single drop of blood can give 23 types of results, and here we will see the hormone balance, hormone diagnosis, androgen, estrogen and progesterone, female hormones, which will be estimated in the blood test. If any abnormalities in these hormones, which is responsible for anovulatory cycles, infertility and pregnancy troubles. Girls who begin to display masculine physical characteristics, that is hirsutism, where they have deepening in voice and increase in body hair and polycystic ovary syndrome, it causes an ovulation cycle, infertility and other pregnancy troubles. And blood tests can be used, and that polycystic ovary syndrome, it will also causes insulin resistance, diabetes, high cholesterol, high blood pressure and other heart diseases also. Blood tests can be used for diagnosis of or monitoring of sex chromosome, that genetic fault karyotyping and other hypogonadism where prior careful history is taken. For DNA profile is also done through blood test because it is the characteristic identification of each individual, and formal assessment in mood change, that cognitive properties in mood change, any behavior and cognitive functions, body mass index, their change in hair, skin and fat distribution in body can be diagnosed through blood test. Next. So, the biometric data will be taken by this methods. They are quite important or great value for preparation of database information about the subject if screened in this manner, and this is they can provide, this database can provide a basis for legal basis and in legal cases and in crime detection also, and this is a new thinking. So similar such work should be started at each district headquarter in the state, and it will become an extensive forum of information or extended forum of information for whole state of Rajasthan and as well as the country. So this national database for our country are useful for demography, for forensic science, crime detection, illegal immigration, and in healthcare and finding clinical solutions also. And in our India, colleges, universities and research centers, which are now thousands in number, they should take part in this national endeavor, and it will make our country safe, secure, healthy and vibrant.